Bill went into effect today. Joining me now, Republican Representative Buddy Carter of Georgia, a member of the House Energy and Commerce Committee, which released the health care bill. And sir, thank you. I want to start with process, and I'd like you to respond to process critiques that are coming from your colleagues on the Republican side. This is Mike Lee. This is exactly the type of backroom dealing and rush process we criticize Democrats for. It is not what we promised the American people. Your response?
Well, first of all, I have a lot of respect for Senator Lee, and I think he's on the right track. However, I have to disagree and respectfully disagree. This is what we've been talking about. What we have rolled out, this plan, is simply going to bring about more accessible, more affordable, more patient-centered health care.
I know that's the line that you guys have, but I just want to talk about the timeline here. You have Paul Ryan talking about marking this up in a matter of weeks and passing out of committee into the floor of the House. You have Mitch McConnell saying it's going to get a floor vote in the Senate by April recess. That's 5 weeks. Do you remember when the Affordable Care Act got its floor vote in the House back in 2009?
Well, I wasn't here, so no, I don't remember
that. It was in November. It was in November of that year. It was 9 months of legislative process, including over 100 amendments, and you guys thought that that was too fast a process.
Well, unfortunately, we don't have that luxury that the Democrats had, because health care is imploding right now, because Obamacare is imploding. We have to do something. If we don't do something and rescue health care now and do it quickly, then we're going to have a mess in this country.
Congressman, I know that you've said this before. You said earlier today that Obamacare is in a death spiral. This is a line I've heard from Paul Ryan and others.
And you heard that from the CEO of Aetna as well.
That's right. The CEO of Aetna is one individual who used that phrase. However, the American Academy of Actuaries, the folks that actually do the calculations for the technical term that is a death spiral, right? That's an actual actuarial phenomenon, explicitly disputes the death spiral claim. You have Mario Molina of Molina Healthcare, which runs a bunch of ACA plans. He said that taking away the mandate, as your plan proposes, could push premiums up 30% in a year and inaugurate a death spiral.
Well, one thing's for sure, that wouldn't take any getting used to, because let me tell you, premiums on average have gone up over 25% this year alone. And in 7 states, they've gone up over 50%.
Right, but
Obamacare has been a total failure. In 16 counties in Tennessee, they don't even have a
Congressman,
but
my question to you is, if the solution to Obamacare, if you're saying the bad old days are Obamacare premium hikes of 25%, we now have this new plan, and it's going to push premiums up 30% next year, that's the solution?
No, that is not the solution, and that is not what I said. What I've said is that our plan is going to increase competition. It's going to increase choices. It's going to increase patient-centered care. By increasing competition and increasing choices, we're going to bring health care costs down. Look, we've got to try something. And we've been working on this plan for many months now, and we've come up with this. It is a better way.
Let me ask you this.
It is a way to get better choices and better opportunities for people.
Choices and competition are sort of the watchwords I've heard, and I want to circle back to that. But you said patient-centered care. Secretary Price talked about that today, and I think everyone agrees that patients are at the center of health care. How does it help patients to repeal a tax break for health CEOs making over $500,000 a year?
Look, this plan does not discriminate against any group, against any industry. We're making sure that everyone is treated fairly, and that is very important in our plan.
How does that help? I'm just asking how that helps patients. That's a provision of the bill. It's not a very long bill. You guys have it's only 60 pages, as Sean Spicer showed today, but you made sure to include a tax break for health CEOs making over $500,000 a year. And my question is, how does that help patients?
This is not a tax break. It is not punitive like Obamacare is.
Right, but it's changing existing
law. How it can be punitive. Right, and that is what we did not want to do. What we wanted to do was to be as fair as we possibly could to everyone involved, not to discriminate against any group or any industry.
Right. But do you think that that has a connection to whether patients get good care?
I think it is look, Obamacare has built up obstacles. We're trying to take down the obstacles, to cut the red tape between patients, between healthcare professionals, so that individuals can have control. They can be empowered and have control over their own health care and make health care decisions between the pharmacist, between the doctor, and between the patient, and not have all those obstacles in between.
I hear that, and I hear that that's what the Secretary Price said. I want to ask you this question, which Secretary Price didn't answer today. The president has said on the campaign trail, everybody's going to have insurance. And I want you to just say for the record, can you guarantee that millions of people won't lose health insurance under this plan?
What I can guarantee is that this plan will create more competition and more choices for people. It will empower them. It will rescue health care in our society.
I got to note crucially, that's not a responsive answer to the question. Can you guarantee that millions of people won't lose health insurance under this plan?
I cannot guarantee anything, but I can guarantee that our plan will increase competition, it will increase choices, and it will increase patient care, and it will make patient care, and it will empower patients so that they'll have the ability to make healthcare decisions along with their healthcare professional. And it won't be mandated from Washington, D.C. It won't be some cookie-cutter program that we say, oh, in Washington, we know what you need, and we know what your healthcare needs are, and here's what you need to do. No, we want to pass it along and empower patients and healthcare professionals to be making healthcare decisions.
Final question. The AARP says you have an age tax in there that is going to be more expensive to older Americans. It specifically lifts the cap on how much health insurance companies can charge in terms of the ratio from 3-to-1 to 5-to-1 based solely on age. That will hurt older Americans, won't it?
Well, certainly that is something that we have to work on. We're looking at that very diligently.
Okay.
It's, age is a factor, let's face it, and it would be wrong for us to discriminate against any particular group. Let's remember that this is just the beginning of the process. We've got a long ways to go. This is the first bucket in what will surely be 3 buckets. And let's also remember we can't let perfect get in the way of good. Representative Buddy Carter, I remember that phrase from covering the first round of healthcare fights back in 2009. Thanks for your time.